So for everyone who's joining here, welcome. Thank you for joining us today. My name is Dashiell Sears, and I am the North American Regional Director for Fast Track Cities, and it is my pleasure to welcome everyone to the Interjurisdictional EHE FTC Alignment Workshop for Baltimore. Thank you for coming today. So, a couple housekeeping things. It's pretty warm out, so we're going to keep everything closed. We're going to keep it as cool as possible, but just let us know if it's getting a little too hot. And thank you so much for the Baltimore City Rec Department, and thank you so much to the Baltimore City Health Department for helping put this together. Without your critical input, this would not have been able to be as successful as it is, and we're going to have a great workshop. So thank you so much. I want to give a shout out to Genevieve Barrow and Shirley Rivers for being extremely helpful in setting everything up and being our shining rock stars. So I want to thank you so much, personally, from my heart. I mean, we're here, we're ready, so let's get it started. So, Baltimore actually signed on as a fast track city. Actually, it was December 1st of 2015. It was identified as an ending the HIV epidemic priority jurisdiction in 2019. So the idea of fast track cities and ending the HIV epidemic were very co-synchronous in our goals. Fast track cities is the global initiative that has a local implementation. Both ending the HIV epidemic and fast track cities are meant to be technical and political initiatives meant to be achieving the 95-95-95 targets, addressing zero stigma, and reducing HIV infection rates. But they differ in what the scope is, whereas ending the HIV epidemic, being its federal initiative, is meant to be housed under HHS with an interagency leadership, engaging with community and local stakeholders. So as you can see, we do work together. Our main goal of Fast Track Cities has always been to support cities in the technical process to achieving these goals under the UN AIDS Charter of 95-95-95, and with cities providing the local connection and understanding their local epidemics. We want to ensure that we are working together to achieve these goals. So the workshop today, we are leveraging synergistic efforts to EHE and FTC initiatives. We would like to discuss these gaps and opportunities to achieving our common goals. As you can see, there are prevention, treatment policy implementations, community access to HIV services, criminalization as a barrier to ending HIV, the equitable scale-up of PrEP, and implementation of status neutrality. We'd like to define short and long-term next steps for addressing EHE and FTC gaps. So without further ado, I'd like to transition over to our president and CEO of Fast Track Cities and IAPAC, Dr. Jose Zuniga.
Well, good morning, everyone, and welcome to this interjurisdictional workshop that brings together the confluence of ending the HIV epidemic initiative in the U.S. and Fast Track Cities. I'm going to bore you with too much detail about Fast Track Cities, other than to say that I'm very proud of the fact that Baltimore was one of the early signers of the Paris Declaration on Fast Track Cities back in 2015, and I'm equally honored that your mayor, Mayor Scott, is going to re-sign and recommit Baltimore as a fast track city. But as important, we'll be signing the Zuniga Declaration on the centrality of affected communities in the HIV response. The Paris Declaration calls on cities and municipalities to place people at the center of the HIV response, but we never, at the beginning of this initiative back in 2014, really articulated what we meant in that respect. So the declaration that we signed, the Zuniga Declaration, lays out 10 specific commitments that cities and municipalities are asked to make to truly place communities at the center, to allow for community leadership to flourish and lead the way as far as the HIV response. I'm happy to note that significant progress has been made in Baltimore, and that work has allowed for a closing of the gap between those people who are accessing HIV and other health services and those who are not. But unfortunately, we don't have 100% coverage. In that respect, we know that there's much work to be done to ensure equitable access to HIV prevention and treatment services that are person-centered and respect the dignity of every human being. As important, the Fast Track Cities initiative, just as it was the EHE, is based on a commitment to multi-stakeholder engagement and commitment from political leaders, from public health leaders, from community leaders, clinical and service providers who are at the heart of the HIV response in our urban settings. The political element is particularly important in that if we do not have our political leaders, and in this case your mayor, on board, it is very difficult to get things done. And that is critical from the perspective of making sure that not the nuts and bolts of the response, but the foundation of the response, the respect for every individual who lives in the city of Baltimore, is something that the mayor commits to in running for office and in serving in this august city. Equally important, the issue of community engagement, and here again the Sevilla Declaration comes into play, but it is an important element that sometimes is too easily dismissed, and tokenism is introduced into planning processes and such. I'm very happy that here in the city of Baltimore, from what I have heard from my colleagues here, that is not the case, that community is robustly engaged, and I want to commend you for that commitment. I will remind us, though, that the deadline for achieving the EHE goal of reducing new HIV infections by 75% is 2 years away. And the goal of achieving the 95, 95, 95 targets, 95% people living with HIV knowing their status, 95% of people who know their status on antiretroviral therapy, and 95% of those achieving undetectable is 2025. And so we have a bit of work to do, but I am convinced that given the leadership that has been demonstrated here in the city of Baltimore from the mayor's office and the Baltimore City Health Department, I'm happy that we have the Maryland Department of Health here as well, our partners at the state level. And as important, that we have our EHE partners. Dr. Robinson's here, EHE coordinator for the Office of the Assistant Secretary of Health in Washington. And as important, the private sector. Vive Healthcare, a longtime partner of the Fast Track Cities initiative, is here, and they'll be saying a few words of welcome. So thanks again for joining us. Mr. Mayor, thank you for being here, and have a great workshop.
Good morning, everyone. Good morning. We're going to do this again. This is Baltimore. We're a little bit more. Good morning, everyone. Good morning. There we go, and welcome to Silburn. If this is your first time, don't make it your last. It's a beautiful place, and if you want to go digging in the grass, somewhere out there, there's a time capsule from me and my third grade elementary school class buried out here that we want to find. Since all the young kids are bringing all our fashion back, so we want to bring all our pictures out to show them that it's not new. But thank you for being here today to support this critical mission and this outstanding partnership. First, I want to acknowledge and thank Dr. Zuniga and the entire team, including IPAC and Fast Track Cities. And most importantly, I want to thank all of our local stakeholders who are engaged in the struggle to halt new HIV infections and end age-related deaths in our community. Unfortunately, we all know too many of our neighbors here in Baltimore have been impacted by the epidemic, which is why we joined this work and this partnership more than 7 years ago in 2015. And in that time, we've been in alignment with this cause and continue our efforts in leveraging determinants of health to improve the lives of all people who call this great city home. And I am so proud of the life-changing progress we've made in the HIV response over the past few years, the relationships and partnerships that we've made with affected communities on issues ranging from increasing testing to optimizing housing opportunities for people living with HIV has literally saved lives in our city, and something that we should be proud of. The partnership has also yielded serious and important results. The number of HIV infections, new HIV infections in Baltimore declined from 541 in 2016 to 170 in 2021, and we still have a lot more work to do. And we will do that by listening and working to our stakeholders, working with those communities, and especially those who have been marginalized and literally forgotten for generations. But even with so many advances, we know that there is still much work to do. We are ultimately striving for no new HIV infections and no deaths in our city. And we're going to work to ensure that no one is left behind in our mission to make sure that that happens. The city of Baltimore remains committed to the objectives of the Paris Declaration on Fast Track Cities ending the HIV epidemic that we signed in 2015, and I'm proud to be reaffirming that commitment today by signing the most recent iteration. We must continue to tackle these public health challenges with every single tool at our disposal. Again, and the most important tool that we have is us, those in the work, those willing to go and talk to those, work with those that people, some folks are quite frankly afraid to do so. We have to go to the most impacted communities, the most impacted individuals with an understanding that we together can end this epidemic. Again, thank you all for your partnership and your devotion to this most noble and most important cause, and I look forward to celebrating the completion of our goals in the near future. Thank you very much.
We will now commence with the signing and some pictures, and then Mayor Scott has to leave, but we'll have our signing now.